Alrighty, I think that's pretty much everyone joined now. So hello everyone and welcome to today's webinar. My name's Hannah and I'll be your host today. And we're delighted to be working in partnership with the Veterinary Cardiovascular Society and with the group able to host a series of free webinars exploring heart problems in dogs. Today's session will build on the insights from the introductory webinar, which was given by Dr Hannah Stephenson, and the follow-up webinar on acquired heart diseases with Dr Emily Dutton, which you can watch both of for free on our YouTube channel. This evening, we'll be taking a deeper look into congenital heart diseases, and we're really pleased to be joined by Dr. Chris Linney, who is the clinical lead and head of cardiology team at the Paragon Veterinary Referrals in Yorkshire, and is also a member of the Veterinary Cardiovascular Society. Additionally, Chris has recently become a fellow of the Royal College of Veterinary Surgeons, which is the highest recognition for contributions to clinical practice and makes him a perfect person for walking us through today's topic. The Kennel Club has developed its health webinar series so we can all hear from experts in their field and discuss important health conditions in dogs. Please be aware that we are not here to offer you individual veterinary advice, so do make sure that you are registered with your local veterinary practice, and please do always visit a vet with any concerns you may have about your dog. Before we get started, please be aware that you will not be able to speak during the webinar, so please do not raise your hand. However, we will be welcoming questions towards the end of tonight's session, and we have received a lot of questions in advance. But if you think of anything during the session, you can easily submit these using the Q&A feature at the top of the screen. The full recording will also be available on the KC's YouTube channel if you'd like to revisit any part of this presentation today, and you'll also be able to find any previous health-related webinars, so please do go and have a look there as we add new content on different topics. So with that, thank you again for joining us today, and I'm now pleased to hand you over to our speaker, Dr. Chris Linney. Thank you, Chris.
Thanks very much, Hannah. Hello, everyone, and thank you for joining us this evening for this webinar on congenital heart disease in dogs. Now, I just wanted to do a little bit of an introduction in terms of why me for this talk on congenital heart disease. Well, actually, it's one of my biggest passions is sharing cardiology, making it accessible, but then also trying to bring together all of the expertise that I've acquired over the nearly 20 years that I've been a vet. I have done extra training in cardiology when we think about minimally invasive procedures, and I operate around the world on cases who have congenital heart disease that need our help. So for me, it's a great pleasure to share this with you this evening in collaboration with the Veterinary Cardiovascular Society and the Kennel Club. So I'm going to start with a picture, and this is a picture that you look through and you see 10 very cute little puppies on this slide, and all of these puppies have one thing in common. I'll give you a second just to have a look through the ones that we see here and see if you can make up a decision on what links all these puppies together. So this little group of puppies here, they are the top 10 breeds that we have registered in the UK with the Kennel Club. And importantly, we're talking about registered breeds here as well. But obviously, there will be some of our little puppies who won't be registered, who may be litters that are unregistered with the Kennel Club too. But this would make up the proportion of the common breeds that we would have registered here in the UK. And I think what this boils down to is about 1 million puppies every year are registered in the UK, and that's a give or take. And you know, during COVID and during lockdown, there was a great big surge in puppies in the UK, and that's probably similar across the world and across all nations. And when we think about those 1 million puppies, the number of puppies or the types of breeds that we see has changed over the last 100 years. So if we go back by 100 years back to 1920, what we would have seen in 1920 is that the top 3 breeds were the Airedale Terrier, in second place the German Shepherd, and in first place the wire-haired Fox Terrier, who some of you might remember was Snowy, Tintin's dog, in Tintin and His Adventures. And if we look at those breeds, perhaps they are breeds that we would think of more traditionally as potential working dogs rather than companion animals. The other thing to note here is the number of thousands of registrations that occurred in the 1920s. So there were 61,000 wire-haired Fox Terriers registered in the UK in 1920s. As we go through the decades, what also you see is that those top 3 breeds change every decade. And there are some frequent flyers. We see them kind of in each decade. But what we also notice as the decades progress is that we start to see the increase in number of companion dogs that we have in our households. And so in the year 2000, you can see there was a great big surge, or in the 2000s, the noughties, 414,000 Labradors were registered in that year, in that decade alone. And the most recent data, because we haven't yet finished the 2020s, was from the 2010s and onwards. And in the 2010s and onwards, our French Bulldog, Cocker Spaniel and Labrador Retriever made up the top 3 registrations in the UK. So here we have 364,000 Labradors, 229,000 Cocker Spaniels and 164,000 French Bulldogs. So it may come as no surprise that the more common that we see these breeds registered, perhaps the more likely we will see them with heart disease. And you will see this as we go through the talk. But how common is congenital heart disease? How worried should we be about it? And where does it sit in the great big scheme of diseases that puppies may be born with? Well, if you look at the literature, dependent on whether you are a pedigree dog or a crossbreed dog, it's probably averages somewhere in about 1% of all puppies in the United Kingdom will develop heart disease as a puppy. Now, take that to the million puppies that we talked about being registered previously, and that makes about 10,000 puppies a year born with congenital heart disease. So there is a decent number of patients and puppies who will be diagnosed with these conditions, or who will be born with these conditions when they are younger. But to get to kind of the nitty gritty, well, what is congenital heart disease? And I'd like to just start with a little video here. This video shows a human heart, and what we see here is the completely developed adult heart, or kind of completely developed heart in a young animal as well, showing both the chambers. So we have the right atrium and the left atrium on here. It shows the great vessels, so the pulmonary arteries and the aorta. But this heart is a very complex structure. It's a cavity. Blood is flowing through the heart. There's lots of nerves. There's lots of cells. There's a lot of opportunity for things to malform as the heart is developing. And congenital heart disease is a malformation or a defect in the development of the heart that leads to a condition that young puppies may then be born with. And the heart, very simply, starts off as 2 simple tubes. So you have 2 simple tubes that fuse whilst puppy is developing inside mum to become a sac. And this is sort of like a cardiac sac where the 2 tubes are fused together. And what we have is that this tube then goes through a series of changes over the first couple of weeks of development inside mum. And eventually what this heart will do is it will start to twist so that the top of the heart goes to the bottom and the bottom of the heart ends up at the top of the picture. And slowly over those kind of first few weeks of development, this heart starts to form what looks more like the heart of a living creature once born. And so here we are, and this is a human. So we see that the time frame here is over 60, nearly 70 days, at which point in our puppies, they're already here, they're already born. But this is sort of from just an image from a human heart. So why is this important? So why is a talk on congenital heart disease important? Well, early detection can lead to very, very good outcomes. We know that if we can identify heart disease at a young age, we can then look at ways to treat it. And we know that there are many treatments that have happened and have been developed over the decades that help us to now provide longer lives for our puppies. And many of these puppies can then live to adulthood with their heart disease. We also know that from human work that heart disease is one of the most common birth defects that children can be born with. And on the right hand side in this picture, we sort of see how complex the heart becomes from where it starts at day 15 in the human, and also in the chick we see how it starts in the chick, and then how it develops over time in the chick as well. So these are very complex structures. And in terms of commonality, well, how often do we see congenital heart disease? I, unfortunately, am very biased on this one because I am a cardiologist and I often will get sent cases of congenital heart disease. So compared to your general practitioner, your GP that you'll see in general practice, I only ever see heart patients. So I don't see the routine patients in general practice. I guess you can liken my role to that of a cardiologist in a big referral hospital and the equivalent of a consultant in a big human hospital. So for me, congenital heart disease makes up about 1/5 of the cases that I see every day. So I would see one case of congenital heart disease every day in my line of work. And it varies between the pedigree dogs and the crossbreeds. So it can be up to 2.5% of all pedigree breed dogs. It can be down as low as 0.1% if you think about your crossbreeds. And that's where that 1% overall comes from that I mentioned previously. When we do diagnose heart disease in those 10,000, approximately 10,000 puppies a year, about 85% of them will only have one condition. But that does mean that 15% of dogs with congenital heart disease will have more than one condition. And the little pie graph that you see here at the bottom just breaks down the most common conditions that we see. And we're going to look at these individually to look at the most common congenital heart conditions that occur in puppies. Now, some of these conditions may not be apparent immediately at birth, and it may be as the dog develops that these conditions also then develop as well. So sometimes you may have a puppy that looks very healthy, apparently healthy when they're very young, but by the time we reach a year old, we might be starting to see heart disease that just wasn't apparent on those first puppy checks. Now, we look at the humans and we look at what comes from congenital heart disease in humans. There are some similarities and there are also some differences. And if we look at the first similarity, it's about 1 in 100 babies. So 1% of babies may be born with a congenital heart disease. Now, that's very similar to what we see with our dogs overall. So, these numbers are quite similar across all mammalian species. What we also know is that the detection of heart disease in children is really quite high compared to what we manage in veterinary cardiology. And that's partly due to the fact that there is pre-screening. So, when you are pregnant, you will have several assessments during pregnancy. So often at your 5-month anomaly scan, they'll be looking at your heart or looking at your baby's heart to assess for any congenital heart disease that may affect delivery or maybe something that needs urgent attention. And about a quarter of all babies or all fetuses can have very severe malformations, sometimes so severe that surgery needs to be performed whilst the baby is still inside mum and yet to be born. And what we know now is about half of all heart disease can be detected pre-birth, so prenatally. And the nice and the very encouraging thing is that we have seen a reduction in mortality rates because of the screening that occurs and the early assessment of babies that occurs as well. And if you think about if any of you have been fortunate enough to have children, that you may know that you get your first check for your baby in the first couple of days of birth, often before you leave the hospital. And often that means that these heart conditions, if they haven't already been detected, get detected almost instantly before you leave the hospital. Whereas often as vets, we will see puppies potentially for a first check before they come in for their first vaccination. But otherwise, it might not be until they are, 8 weeks, 10 weeks old when they come in for that first vaccination. And at which point they've been living with a heart condition potentially for 3 or 4 months of their lives. So we're going to now take a deeper dive into the common congenital heart conditions that we see. And when we look at those conditions, there's some important caveats that we need to remember. Because when we look at studies and we look at the data about what conditions are most common, there are a number of factors that influence this over time. So the first is the ability to diagnose. So as time has gone by, ultrasound has become more and more advanced, and we're able to pick up much more abnormal heart disease or very subtle heart disease that previously we would have struggled to pick up. The other thing to mention is that, as you saw from the graph of the 1920s right through to now, is that the breeds that we see change each decade. So what may have been applicable for the 1990s may no longer be applicable in the 2020s. So it's important that we remember that as the breed commonality changes and we see more of particular breeds being registered, we see a change in the most common breeds presenting with congenital heart disease. The other thing to mention is that it's reliant on detection of heart disease by your veterinarian. And so sometimes the heart disease can be challenging to detect, and other times these studies are done in referral populations. So much of the information that we have comes from big hospital data. And these are puppies that have been referred for assessment. So firstly, they've reached a particular age because they've been assessed by a vet. Second, they've come to a referral hospital where they've had a complete diagnosis. And this means that we can sometimes see the data is sometimes changed because of those factors. And finally, the data changes dependent on where you are in the world. So if we look at the data from the US, we look at the data from Europe, and then we look at the data from the UK, every geographical location has slightly different data in terms of which conditions are most common. And so it's important just to be aware of that. That said, the top 3 conditions that we see are the top 3 conditions in each of those geographical locations, but they change between the different countries. So our top 3 conditions that we see around the world are aortic stenosis, pulmonic stenosis, and what's termed on here is PDA, which is a patent ductus arteriosus. And in the United Kingdom, our 2 most common conditions that we see, or that are reported in the literature, are pulmonic stenosis and patent ductus arteriosus. So we'll spend quite a bit of time on these 2 conditions, but we will touch on all 6 of these conditions, which make up the most common conditions reported in young animals. So what breeds then do we see with these individual conditions? Because there certainly are breeds that are more commonly seen with some of these conditions than others. And we're going to work our way around this list and look at the breeds that we see with these conditions. So when we think about aortic stenosis, breeds that are commonly reported to have this condition include the Golden Retriever, the Boxer Dog, the Dog de Bordeaux. And these breeds will be more likely to have this condition than other breeds as well. And so if we look at the boxer is 7 times more likely to develop aortic stenosis than another breed. The Dog de Bordeaux, is 11 times more likely to develop aortic stenosis than any other breed. And the Golden Retriever, 3.5 times more likely to develop aortic stenosis than any other breed. So it's important to remember these factors as well. Now, a ventricular septal defect, commonly seen in German Shepherd dogs, in French Bulldogs, but also in all terrier breeds as well. So any of the terrier breeds can be seen with ventricular septal defects more frequently than some of the other breeds that we know as well. The French Bulldog also appears in the list for pulmonic stenosis as well. And in the literature, being a Frenchie makes you 19 times more likely than another breed to have pulmonic stenosis. Now, this data that we're looking at here comes from Italy specifically. And so there will be some differences between countries, but the French Bulldog is also the most common dog that I will see for pulmonic stenosis surgery here at Paragon. It's also common in the West Highland White Terrier, the Labrador, the Cocker Spaniel, the Golden Retriever, the Whippet occasionally from time to time, and other breeds can get this condition as well, but those are probably the more frequently observed breeds. Now, PDA is another common condition that we see, and the German Shepherd, the Cocker Spaniel, the Maltese, the Border Collie, the English Springer Spaniel, the Labrador, and the Poodle are all breeds that are predisposed to this condition. I'm just going to jump through that slide one more time. So when we think about the PDA, the other thing to note is that there has been a large surge in the number of first-generation crosses between Spaniels and Poodles, between Labradors and other breeds as well. So those first-generation crosses we see those more frequently here in the UK, and they are as predisposed to these conditions as much as the pure breeds as well. And so if I look at my most common breed for a PDA over the last 5 years, it would be the Cocker Poo, would be the most common one that we would see. And the second would be a Cavapoo, followed by the pedigree breeds as well. Now, mitral dysplasia is frequently seen in the Labrador, in the Cocker Spaniel, and in the English Springer Spaniel. And tricuspid dysplasia, which we'll go through what all these different conditions are shortly, is in the German Shepherd, the Labrador, the Golden Retriever, the Dog de Bordeaux, the Frenchie, and the Boxer as well. So what might not be a surprise now when you look at these breeds is that we've seen most of these breeds on that first slide of the puppies. These are the top 10 breeds in the UK. So it goes in hand that if you are a breed that's more commonly registered and there are more of you in the country, you're more likely to have that breed represent themselves in these particular studies when we look at how frequently these diseases occur. But what we also know is the odds ratios mean that that breed is however many more times likely to have the condition. And for example, if we think about the Frenchie and pulmonic stenosis, the Frenchie is not registered in the UK 19 times more than the next most common breed. And yet the condition is 19 times more likely in the French Bulldog. So whilst it might be because there is a link that there are more of them, so we're more likely to see it, there is an over-representation of that breed, irrespective of the fact that there are more of them registered in the UK as well. So how are we going to diagnose clinical signs of heart disease, and what symptoms is it that we're looking for? And to start with, what I would like to do is get you to have a think about what would make you suspicious that your dog might have a heart problem. So if you were taking your dog into the vet practice, or you had your dog at home and you were watching particular things that they were doing, what kind of things would make you think your dog might have a heart problem? Just take a moment to have a think about that. I'm going to just give you one moment to have a consideration there. What things might you go to your vets with if you thought your dog had a heart problem? So we haven't got the Q&A enabled, or the chat enabled, but I can imagine that a number of you have been thinking about some of these signs that we see here on this slide. And I'm going to start at the second point on here, which is breathlessness with exercise and or rest. So some of our dogs that have heart disease, they may have increases in their breathing rate, or they might have difficulty breathing either at exercise. And if it's a very bad heart problem, it may even be that it's not exacerbated by exercise, but it's also apparent at rest. Their gums might be a different color. So sometimes they might be pale, sometimes they might be blue. And these changes in the gum color are to do with circulation. So if your heart isn't circulating blood around the body properly, we will see changes in the way the gums look as well. Some animals with very severe heart disease may develop swelling of their bellies. So they might develop fluid retention in their bellies. With some of the more severe conditions, we may see fainting and collapsing. So some dogs may present with a history of fainting or collapsing, either with exercise or excitement, and sometimes just pottering around at home without doing very much exercise. There's often a description of coughing as well. And we know that dogs with heart disease do cough, but often that cough is not a sign that the dogs are in heart failure, that the heart's struggling to fail, but there's a link between coughing and heart disease. And then you have your vague signs. So the signs that really don't tell us exactly what's going on, but they do tell us that the dog has a problem. So things like lethargy and tiredness, exercise intolerance, as much as weight gain, if these dogs get great big distended tummies, it might be that they just fail to gain the weight. So there might be failure to thrive in these young puppies as well. And here on the right is a little dog called Bertie. Bertie is a little whippet that came to see me. And he is the point that I want to make about heart murmurs and can you feel it? So I really urge you and encourage you, if you do breed or if you do have a new recently acquired puppy, that you can actually detect very serious murmurs at home. It doesn't necessarily lie just in the vet's hands on this one. And what we can sometimes see is if you have a very severe heart murmur, is actually sometimes we can actually feel that heart murmur on the chest. And so if the best thing to do if you have a young puppy, and I'd recommend this if you have a litter of puppies, as much as if you've just taken on a puppy as well, is to put your hands under their armpits. So have your hands under their armpits with the palms of your hands against their chest. So you're kind of holding them and hugging them around their chest, but under their armpits. And in dogs that have very severe heart problems, we actually sometimes will feel the heart buzzing on the chest. So if you think about your own heartbeat, or if you have a dog at home and you can feel its heart, what we'll often feel when we touch the chest of the dogs is like a little tap, and that's just the normal heart beating. But if your dog has a very serious heart murmur, what will feel that's different to that is it almost feels like you might be touching a buzzing or a humming beehive. So you imagine that kind of vibration of all the bees buzzing within a beehive, and you put your hands on your dog's chest and you get this feeling of like a constant hum or buzz on the chest. And that's what we would consider to be a very loud heart murmur. And Bertie, this little whippet here, presented with a thrill that had been detected at home by the breeder. So when we talk about a heart murmur, what is it that we're really saying? What does a heart murmur mean? Well, a heart murmur is just abnormal flow through the heart. So when we hear a heart murmur, what we're hearing is flow through the heart. And it can be abnormal and pathological because there's an underlying heart condition. But sometimes it can just be that we're hearing normal flow moving through the heart. And for various reasons, it's easy to hear that and detect it. Now, normal flow through the heart is not going to give you those great big thrills that we feel on the chest, that buzzing sensation on the chest. That would be certainly an abnormal or pathological condition. suspicion. But when your vets listen to the dogs and the puppies in the clinics, they might pick up some very low-grade heart murmurs and say to you that actually this looks like a flow murmur rather than something more serious. But whenever we feel that buzz, that immediately puts a red flag on it, and we need to look at investigating that further. Now, what your vets may also say is that your dog has a certain grade of heart murmur, and heart murmurs are graded from 1 to 6, and there's also a 0 as well. So grade 0 being no murmur whatsoever. Grade 1 would be a quiet murmur. So this is a murmur that's quite difficult to find, low grade, grade 1. And then we go through the stages from 1 to 2 to 3 to 4 to 5 to 6. And 6 is the loudest murmur that you could possibly imagine. And so kind of a 3 is like a moderate murmur, somewhere in the middle of the road. Now, some vets will use that grading scale of 1 to 6. Other vets might use low, moderate, severe, and thrilling. So they might use a 4-stage system, and both systems have been validated. So both systems give us the information that we need to know. So a grade 3, 4, 5, or 6 murmur would be the equivalent of a moderate, a severe, or a thrilling murmur. And those are murmurs that don't tend to go away as puppies get older. So those murmurs are murmurs that we'd be thinking about investigating, as we say here. So a grade 3 murmur or louder would make me want to recommend evaluation. And if it's grade 4, a grade 4 murmur is a murmur that's very unlikely to disappear if it's still present at 6 to 8 weeks old. So in days gone by, we may have recommended actually just sit and wait and see whether it disappears. That advice has completely changed. We'd never recommend sitting on a grade 4 murmur. That dog might have disease that could potentially be curable. But if we wait until it starts to show signs of that, we may have missed our opportunity to act. So in the background, hopefully you have your sound on. Well, probably you do have your sound on because you can hear me. But in the background, what you'll be able to hear here is a heart that's beating. And I will play this again for you without me speaking over it in a moment. And what we're hearing there is the normal heart sounds, and it's a lub-dub, 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 lub-dub. It's 2 very crisp heart sounds. So I'm going to play that one more time, because after that, I'm going to play you 2 different types of heart murmurs. And what I'd like you to do is when you hear the first one, compare that to the second 2, and then we'll have a little talk through that in a second. So here comes the first one again. So that's our normal heart sound. That's what the heart would sound like if you had a stethoscope. And you may have heard that it was slightly irregular. So speeding up and slowing down, that's very normal. The heart speeds up and slows down, especially in our puppies. The rhythms can be quite irregular in young puppies, and that's just part of their development. It's not something that we tend to worry about. Now, these next 2 clips that you're going to hear, these are dogs that have heart murmurs. So I almost liken that one to a steam train pushing down the road like a whoosh. And that's that sound that we hear when we have a murmur. And here's another one to listen to as well. And so when your vets hear a murmur, that's what they're hearing. And that murmur correlates to flow of blood through the heart. And typically with those 2 that you've just heard, those last 2, that would be a very severe heart murmur. That would be a murmur that I'd be recommending investigating. In fact, both of those dogs came to me for investigation of heart disease and congenital heart disease. So once we make that assessment and we hear a heart murmur, how are we going to then diagnose it? How are we going to know whether it's important to investigate it? Well, first off is we will always start with our physical exam. And the physical exam is our non-invasive tool that actually gives us that index of suspicion. There'll be things that we might pick up on our physical exam that allows us to say, actually, there is something here going on. It may be the presence of a heart murmur, or in this lovely English Bull Terrier, you may also see that they have other signs too. So this lovely little Bull Terrier, she has a great big swollen tummy, and we see it from the side a little bit easier. And she almost looks like she's heavily pregnant, but she is only 9 months old, and this is kind of her with a great big belly full of fluid. What we know from our physical exam is it's a way for us to identify heart disease, but it doesn't tell us which type. So from here, we need to do further assessments to understand what exactly is going on. And from there, your vets might recommend blood tests. Blood tests, again, they're relatively non-invasive. It does require taking a blood sample from the vein. And the thing with blood tests is it will increase our index of suspicion for congenital heart disease, but it doesn't diagnose it. So we might be able to say, well, yes, the heart's under a bit of strain and stress, but we wouldn't be able to tell you which particular condition. So it's a adjunctive tool rather than anything that's going to give us a confirmatory diagnosis. Now, your vets may also recommend an ECG, so an electrical assessment of the rhythm of the heart. And this is typically recommended when an irregular rhythm is heard, which doesn't sound like the typical one that we'd see in young puppies. Again, it's non-invasive. Here you see Izzy. Izzy's laying on a vet bed here having her ECG taken. And at the bottom, you see an irregular rhythm on a dog as well. So what we're seeing is a rhythm that's quite fast. You see it says 189 beats a minute. Normally, a dog's heart rate would be about 60 to 90. And then it changes. So you see at the bottom there at the beginning, it changes. And it goes back to that funny rhythm again. And then it changes to a different shape here as well. So what we've seen here is the dog developed a very fast heart rhythm, and now it's gone back into its normal heart rhythm at this stage. And it's that difference in the way that the kind of the complexes are looking. So those first green squiggles are very big, and as this ECG progresses, we see them change back to what looks like a little bit more of a normal complex. Again, an ECG is generally not diagnostic of heart disease, but it might increase our suspicion because young puppies shouldn't have this type of irregularity to their rhythms. So this might say to us, well, actually here, there is a rhythm problem, but now we're going to need to do more tests to understand what's causing it. And at this point, your vets may then say to you, we need to do more investigations. Not every dog will have blood tests and not every dog will have an ECG. And so dependent on what facilities your vets have, they may recommend x-rays. Now, we use x-rays because they're non-invasive, but often to get the pictures that we need, that it's not a big blurry motion because the dogs aren't staying still, is that we'd need to give a little bit of sedation to keep the patient nice and calm on the table. It's very useful for screening. However, in terms of picking up congenital heart disease and making a diagnosis, it's only helpful in about 40% of cases. So you think if you have a test that only picks up 40% of cases, it's probably not the best test to be using. Which brings us on to probably what I consider to be the optimal test when we're thinking about congenital heart disease. And that is an ultrasound of the heart. Now, an ultrasound is a non-invasive tool. We rarely have to give anesthesia. Very rarely we have to give sedation. But most of the time for our little puppies, we just have a good play in the room for about 5 to 10 minutes. And as you know, once a puppy's had a good mad play, they want to settle down for a sleep after that, especially when they're very young. And so we rely on that of getting the puppies tired to then do their ultrasound scans. It's a really great test for assessing for heart disease because it picks up over 95% of all congenital heart conditions. And that's kind of in the hands of an experienced operator like myself. So it's a very, very useful tool when you have an operator that's used to diagnosing with that particular tool. So as well as the diagnosis, it can tell us about how severe the condition is, and it can also then give us an idea about the prognosis. So there's many things that we pick up from the ultrasound, not just to tell you what's going on, but what that looks like for the puppy as they grow older and what it looks like for the prognosis for them as well. And this little Staffordshire Bull Terrier puppy that came to see me has had a mad play. And this is the puppy literally just falling asleep on the table. So there's no sedations involved here. She's had a mad play and now she's just resting on the table. And as you can see, it's a really relaxed, very calm environment for the puppies. We try to keep it like this for them because if they do have a congenital heart condition, it's very likely that we'll need to see them as they grow. Here, this little Bull Terrier, in this video, she's about 5 months old here. And sometimes for some conditions, we're not going to know how bad they're going to become until they're fully grown. So we want this to be a really pleasant experience for the puppies, and this is kind of how we achieve it. We just make it a nice relaxed environment for them. And for me, this is the winning tool. So if I'm thinking about what can I do, what's the best way for me to look for heart disease in your puppy, it's going to be with ultrasound in the vast majority of cases. So what I'd like to do at this point is actually go into a bit of a deeper dive into the individual conditions. So looking at those really common conditions that we see and then breaking them down into what it is that we might see, what it is that we can do for them, and then also what the prognosis looks like with and without interventions. This here is a giant manta ray that in high season they all come together to breed together, and they all sort of just congregate together, and you'll see like 50, 100 manta rays all just swimming together in a pretty glorious and unforgettable kind of dance of unison. And you just see one in the background here, the two of them just having a quick hello, how you doing there in the background. So we're going to start with the PDA because, as I said, this is probably the most common condition that I see, and the first thing to say about a PDA is that the ductus arteriosus part of a PDA is something that we're all born with. So we are all born with a ductus arteriosus. And I've just drawn a little circle around that ductus, which is that small little vessel circled in green at the top of the picture. Now, this is a very important vessel when we are growing and developing inside mum, because at the bottom of this picture on the left is where all of the nice oxygenated red blood comes from. It comes from mum's placenta. It crosses into our bloodstream via the placenta and the umbilical cord, and that blood then is taken up to the heart and then disseminated around the body. But when we're inside mum and we aren't breathing for ourselves, we don't need a lot of blood to go to our lungs. And so this ductus arteriosus is basically a bypass vessel. It allows all that blood to make its way out of the heart and supply blood to the body. And so the body can develop whilst we're growing. Now, as soon as we're born and we're cut off from mum, we're no longer using our placenta. And the first thing that puppies and children will do is they'll often take that first big breath and gasp. And that's them opening up their lungs and inflating their lungs. And as they do that, what will happen is that ductus arteriosus, because of the oxygen that goes through our blood system, then through our lungs, causes that vessel to clamp shut. So basically, it completely constricts down and it separates the two sides of our circulation, so that they are two separate circulations that don't have this communication via this little ductus. But in some puppies, it stays patent, so it stays open, and they have a patent ductus arteriosus. And this allows blood to communicate between the two sides of the great vessels when it shouldn't be. And eventually what happens is the heart becomes overloaded with lots of circulating blood. It becomes dilated. And eventually, if we don't intervene with this condition, the dogs will succumb to this condition in about half of the cases. Now, it's a young animal condition. We said this vessel closes when you take your first breath. So we're expecting this condition to be completely absent in every single dog by the time that it gets to about 7 days old. And generally, most of these dogs, they'll close within the first few hours. So their ductus will close when they take their breath. It will constrict, but it's not sort of like a complete sudden constriction. It takes a little bit of time to constrict down, but we're talking hours rather than months or anything like that. This murmur is the one that you will feel as that very prominent heart murmur on your dog's chest. So when we look at the breeds in this little circle at the bottom, this would be a heart murmur that we hear, that we can feel under the dog's left armpit if you had a puppy that had a PDA. Much more common in females than males. So there's a predisposition for the females, 75% female to 25% male. And this is something that's seen across all studies and in my clinic and practice as well. And the good news is most of these puppies, when they present completely asymptomatic. The vets pick up a heart murmur or you notice the heart murmur at home. But in about 1 in 5 cases, so in about 20% of cases, these puppies will come in and they'll have difficulty breathing. So they'll already be in heart failure when they present to the veterinarian. And I think what's really important with this condition is that it needs to be evaluated as quickly as possible. A murmur like this is not a murmur that you want to sit and wait to see if it goes. If you can feel it on the chest, it needs assessment immediately. And this is because about half of all dogs with this condition, if it's untreated, will die within the first year of life. And pretty much every dog will develop signs of heart failure by middle age if we don't close the PDA. If we do close the PDA, these dogs are expected to live a normal life, particularly if we get these dogs at a very young age. But the longer that you leave this heart with that circulation and the strain that happens on the heart, the less likely we are to get a good outcome. So the best way to operate on these puppies is when they're very little. It gives the heart the opportunity to recover and for them to have a really normal shot at life. If you look at the studies that are out there, it says that dogs will live for about 10.5 years after PDA closure if it's done early. If you think of all the breeds that we see and the differences that each breed will have in terms of longevity, that effectively is giving the dog a shot at a normal life. Now, as the decades have gone by, this is now a keyhole procedure. So my centre and a number of centres around the UK specialise in keyhole surgery. And so I'm very fortunate to kind of be one of the more experienced surgeons with this procedure in the UK. And success rates approach over 98% with the procedure that we do, which I'm about to show you. The nice thing also is that these puppies have a very quick recovery. And on ultrasound, so these are two ultrasound pictures that we have here, and the PDA, that little kind of that little vessel that was communicating between the two big great vessels, is circled for you here. So this is the little vessel that is communicating, and we see it on the ultrasound picture here. It's the one that looks a little bit like a finger, a little finger projection in the center of the circle. And we use various methods with ultrasound to sort of look at the flow, and that green, very noisy, pixelated flow that you see on the right hand image on the bottom here is all the flow that's communicating between the two sides of the circulation. And it's this green flow that's going to cause these dogs to develop issues with their heart if we weren't to close this PDA. So how do we do that? Well, it's keyhole. We do it through a very small incision in the groin. And if you look at this little incision, which is in the center of the drapes here, so in that little triangle that you see within the middle of these drapes, that little incision is smaller than my thumbnail. So this is a very small incision that allows us to pass a series of catheters up to the heart to close that vessel, which I'm about to show you just now. So what we do is we pass our first catheter here, and the catheter that you see, is the little thing with the dark the dark squares on it. And in a second, you're going to see lots of black, and the black is contrast agent that we give, and this contrast agent allows us to see the flow of blood through the great vessels and through the PDA. And so this is basically a 3D real-time movie that we're using X-ray to have a look at the heart on. So that black there is the contrast, and I'm now going to slow that down for you. And what we see is the black contrast is going in many different directions. It's making many different blood vessels look dark and black. And I'm going to now show you a picture of this completely slowed down. And the PDA is labeled here on the right hand side. So what we saw on the ultrasound is now shown on this image here. So we call this an angiogram, which is effectively just a sort of a video using X-ray. And once we know where that PDA is, we then pass a little device into it. So in the first video, what you're seeing is a little device that plugs that PDA. And so this little device sits crossing the PDA, it straddles that PDA, and it almost looks like a bit of an upside down umbrella. And there are two of them. So these two umbrellas sit in the PDA and they completely plug that flow. What then happens is this device is then released in position. Once we're happy it's nice and secure. And then the device will sit there inside the puppy's circulation, and the body will basically form a skin around it to hold it in position. So as the puppy grows, this device just sits in situ and stays nice and quiet there over the many years that these puppies will then be alive. And in the last picture that I'm about to play for you, what we see that black contrast, but it only sits in the cup of that device. You don't see it go through the cup anymore. It blocks the flow going into the rest of the circulation. So effectively what you're seeing here is that the PDA's been completely plugged, and that looks a bit like this. So that's what should have happened for this little puppy when it took its first breath, that device, or the body should have caused a constriction, and we're able to do that with a little device when that doesn't happen for the puppies. And the prognosis for these puppies is excellent. So for us, this is one of the things that we can consider a cure. We can cure this condition and give these puppies a real good shot at a normal life with closure of their PDAs. But it does require early intervention. The next condition, or the next most common condition that we see, is coming up in 1 second. To just show you this picture here, this was the green pixelated flow that we saw going through the PDA before we closed it. And the picture on the right-hand side is now showing the little device. So in that little white square that you just saw, this little device is just shown here in the center. So this is what it looks like for us. And the difference is that all of that green flow that we were seeing before has completely gone. And that's a complete cure for this condition. So our next condition to consider then is pulmonic stenosis. So what is pulmonic stenosis? Well, it's a narrowing of the outflow from the heart. So it's a narrowing of the blood being pumped into the great vessels from the right side of the heart up towards the lungs. And on this image here, it's labelled as pulmonary stenosis in the top right-hand side. Now, this is much more common in dogs than cats, but we occasionally see it in cats as well. And the breeds that we often see with this condition are shown in the bottom right-hand side. Now, these dogs will often present asymptomatic, so no clinical signs, they're absolutely healthy, other than your vets have noted a heart murmur. They may, though, if it's very severe or if it's a very advanced case, they may show signs of difficulty with exercise. If it's very severe, they may be collapsing. And if they have very advanced heart disease, it might be that they're starting to show signs of failure. And with this particular condition, the failure sign is a great big swollen tummy full of fluid. Now, when we talk about collapse, I thought it was important to sort of show you what we're looking at with collapse and to make a note of, if you do have a little puppy that's collapsing, a video can be really helpful for your vet to understand what's going on. So both of these dogs were presented to me as a cardiologist. Both of these dogs had a history of collapse. And I'd like you just to contrast how these two different dogs look during their collapse episodes. So the little spaniel on the left is presenting with a history of collapse. So the owners sort of say, well, she becomes very still. She falls down onto her belly. She looks very wobbly and very disorientated. And then she rolls onto her side. And that's exactly what she did here in the consultation. But the other thing that we notice for her is that her limbs are very, very stiff. She's very rigid, and rather than having full convulsions, her legs are very stiff. And then when she stops having those very stiff, jerky movements, our nurse here is feeling her pulses. The pulses are nice and regular. She doesn't have irregular pulses. But she's puffing and panting away. And when you have a seizure, when you have a dog that's having a seizure, all of their muscles become very rigid and they kind of contract and relax very, very quickly. And with that, it's almost like they're running a marathon in a very short space of time. So their body is asking them to do a lot of work, all the muscles to do a lot of work, and they get tired very, very quickly. Now, contrast that video, which is a dog that was having what we call a partial seizure or a focal seizure, to the next video. So the dog on the right-hand side, she's called Ginger. She's a little Cocker Spaniel. She's just about to go out for her last wee of the evening. So Ginger finds a nice little spot in the garden to go for a wee. But on the way, starts to get a bit wobbly and falls onto her side. For a second, she's completely still and lifeless and not moving. And then you see that she's starting to paddle her feet. A little Peke gets in on the action, little Pekingese. But Ginger's down for a little while. You see she's still breathing, kind of deep breaths there. But she's still very quiet. She's still down. She's not moving. And then she starts to kind of rouse a little bit. She starts to kind of wonder what's going on. She starts to kind of look a little bit more awake and aware of her surroundings. And it's almost like she's back in the room straight away. Yeah, maybe a bit wobbly to start with. You can see she's got her back legs out just to steady herself. But once she realizes that where she is and she's back in the room and aware of what's going on around her, she carries on with what she intended to do. So there she goes. She manages to go for a wee. And when she finishes her little urination here, you'll see that she walks back to the house completely normal, as if nothing has happened. And that's quite typical of our dogs when they have a heart problem. So this video on the right-hand side is a dog with a heart problem. The video on the left-hand side is a dog that doesn't have a heart problem. But you can see how it can be challenging to differentiate that. And for us as veterinarians, it's really helpful to have videos if you're able to get them. But I completely understand that in that moment when your dog is having an episode like this, to remember to have a video camera or a phone to record these things is probably the last thing on your mind. But it can really help to make sure that we investigate these patients appropriately. So if you're able to get a video, it paints the picture of 1,000 words, and it really does help us sometimes to advance our understanding of these cases. So back to pulmonic stenosis then. So when we think about stenosis, it comes in different flavors. There are different levels of severity, from mild to moderate to severe. Now, when we look at mild disease tends to have no outward signs. These dogs might present to your vet with a heart murmur. So nothing that you would notice from the outside. With mild disease, you won't be able to feel the murmur at home, but your vets might detect the murmur when they listen to the dog's heart. There'll be no outward signs, and actually with mild pulmonic stenosis, these dogs will live a normal life. So treatment is very rarely indicated. It's just that their valve has not developed completely normally, but enough to live a complete normal life. Now, with moderate pulmonic stenosis, this is where there's been a bit more kind of irregular development of the heart valve. And again, most dogs are going to do very well with this. And they might require treatment, but it's often medical treatment rather than surgical treatment. But if the dogs are showing signs of difficulty with exercise, or if on their assessments by your vet or by your cardiologist, it may be that surgery is recommended to take some strain off of the heart, but not in every single case. And these dogs are expected to go on to have a nice normal lifespan if they have this condition. It's very rare that we see sudden death or anything like that with this group. But that changes when you get to the severe category. So when you're in the severe category, it's very clear that those dogs without any form of treatment or intervention are going to have a poorer prognosis than their cousins in the mild and moderate groups. So we would generally recommend surgery of some description in this severe category. And we know that if we don't operate on these dogs, that their survival is limited and it is reduced. And it may be, if they're lucky, they make it to young to middle age if we don't intervene in this severe category. Now, sometimes it might be surgery, and sometimes surgery is just not possible or plausible. And in those cases, we might think about medications to try and help to improve the dog's symptoms. However, those medications haven't been shown to improve survival. So the only thing at the moment that improves the survival for these severe pulmonic stenosis dogs is if we can improve the level of kind of narrowing of the valve. And so when we think about surgery, we're aiming to improve the severity of the condition. And that, again, is often by minimally invasive surgery, either by using a balloon to stretch the valve and open up that valve, or sometimes we place a stent, so some metalwork inside the heart to keep that narrowed tube open if it's very narrow. And again, cardiologists would then advise you on what's the most appropriate method for your dog, because not each method is appropriate for everybody. And so it is really case by case of what's most appropriate for your individual pup. Now, there are open heart surgeries that used to be performed very regularly, particularly kind of in the 1970s and 80s and 90s. But this really has become a minimally invasive procedure from the year 2000 onwards. And what we do is we do a little contrast study, again, as we saw for the PDA. And on the left-hand picture, what you're going to see is the blood going through the heart and out through the great vessels. And I am then going to put a little circle around the narrowing, which is right in the center of this picture, where you sort of see a bit of an irregular shape to the pulmonary artery here, and that's where the pulmonic stenosis is. And then on the right-hand image, we're inflating a little balloon, and the balloon, first off, it forms a little figure of 8. So you see a balloon with a little pinch in the waist of it there. And what we then see, I'm just going to pause this video at that little pinch in the middle of the balloon for you. So you see that, just stop that 1 second. So you see here, there's like a little pinch in the middle of that balloon. And that's where the narrowing is in this pulmonic stenosis. So what we do is we inflate the balloon, and it opens up the narrowing, and then we deflate the balloon and everything comes out of the patient. So everything comes out of the dog, and the valve is now moving more freely so that the blood can exit the heart and take the strain off the heart, so that these dogs that needed surgery can then go on to have a better and more normal shot at a normal life then as well. So similar to pulmonic stenosis is aortic stenosis. So aortic stenosis is a narrowing of the great vessels, but rather than it being from the right ventricle, it's now a narrowing from the left ventricle to the blood that gets pumped out to the body. So aortic stenosis limits the amount of blood that you can eject out of your heart into your body. And much like pulmonic stenosis, it's graded as mild and moderate and severe. The signs are very similar, so similar to what we see with pulmonic stenosis. And your dog may only present with a heart murmur to your vets. But if it's more severe, we might start to see a cluster of symptoms, which might include lethargy, exercise intolerance or wobbliness with exercise, sometimes fainting with exercise as well. If it gets very severe, we might see that the dogs have difficulty breathing. And in the very sad cases, some of these dogs, when their hearts have a very, very tight constriction, is that they just cannot get enough blood out of their heart to meet the demands of the body. And so, unfortunately, this is a condition that sometimes results in sudden death as well. Now, the breeds that we mentioned before include the Golden Retriever, the Boxer, and the Dog de Bordeaux, but we can see it in lots of other breeds as well. These are just the ones where it's more frequently seen. So what do we see with mild? Well, exactly like pulmonic stenosis, with mild aortic stenosis, there are no outward signs. These dogs have no need for any treatments, and they live a completely normal life. In the moderate category, it might be that with exercise you see them tiring a little bit, but generally they're not going to show any outward signs to start with. But it's really where it changes is in the severe category. So in the severe category, what we see is that there's a 20% chance of a dog having a sudden cardiac death. So running around one moment and no longer with us the next moment, which is really, really soul destroying and very harrowing for owners when it happens. But generally, these dogs will be running around having the time of their life when it happens. So, the only kind of comfort that we take from it is often that they are doing the things that they love when this might occur. Now, we also know that a third of these dogs will come in with clinical signs. So the signs that we saw on the slide before, lethargy, exercise intolerance and fainting, panting and difficulty breathing. And we are able to do surgery for this condition. However, the surgery really is there to help to improve their quality of life. It can improve their symptoms, but actually the surgery hasn't been shown to prolong the lifetime of these dogs. So we do recommend surgery where it's really affecting day-to-day quality of life. But we know that the risk of them having issues in the future remains. So whilst we can help the dogs live a happier life for the time that they're with us, it's often not that we can extend that life beyond what it would have been had we not operated. So now we're getting to the less common conditions, but still frequently seen nonetheless. And the next one is ventricular septal defect. Now, this is a communication between the two lower chambers of the heart, so the two ventricles. And effectively, it's a little hole in the muscle that should separate both the left ventricle from the right ventricle. So in our picture here, what we see is that blood can communicate between both sides of the heart when it really should be separated, and the two circulations should be separate from each other. And when you look at the picture here, it's showing you a relatively big hole, a relatively big defect between the two chambers. But these holes can be of many different sizes, from very small pinpricks to very large defects. And in terms of what the dogs may show in symptoms, it very much depends on how big the hole is. So with a very tiny hole, the amount of blood that gets squirted across that hole is negligible, or has negligible clinical effect. Whereas when you have a very big hole, it allows the mixing of blood from both sides of the heart. And those dogs are more likely to have symptoms. So they might have difficulty with exercise, they might become blue with exercise, or they might have difficulty breathing because of all this extra circulation through their hearts. When the holes are very small, the murmurs are super loud. So when we hear a loud murmur, it can be a loud murmur with a very small hole from a ventricular septal defect. There are surgeries that can be done for this condition. It's very rare that dogs need surgery, but there are the occasional cases where we do recommend a surgery. But most dogs with a ventricular septal defect, we don't need to manage them. The condition manages itself. But obviously, we need to diagnose it to know that it's not any of the other conditions that might sound like this as well. Then our last of those 6 conditions that you saw on that first slide, we've gone through patent ductus arteriosus, pulmonic stenosis, aortic stenosis, ventricular septal defect, and the last of those 6 is mitral and then tricuspid valve dysplasia. And dysplasia effectively just means an abnormal development of tissue. And the tissue that we're talking about in this case is the valve itself. And this is the valve that separates the top and the bottom chamber. So if the atrium from the ventricle, if you like. And if it's on the right-hand side, it's called tricuspid dysplasia because that valve between those two chambers is called the tricuspid valve. And if it's on the left side of the heart, it's the mitral valve separating the left atrium from the left ventricle. And often when these puppies are young, all that we're going to hear is a heart murmur. It's very rare in that very young puppy that we're going to find any symptoms. But this is a condition that allows backflow of blood through the heart. And so this is one of those conditions that gets worse as the puppies get older. So what they're born with is not what we might see kind of 6 months, 9 months, 12 months down the line. And a bit like the ventricular septal defect, it comes in different levels of severity. So the more severe the dysplasia, the more severely abnormal the heart valve, the more likely those dogs are going to progress over time to have clinical disease. And this is a challenge for us to manage. So to manage congenital congenital valve disease is quite challenging. And we're really kind of at the infancy of managing this condition, which can either be managed with open heart surgery, it can be managed with minimally invasive surgery, but it might be that your vets manage it with medications, or if it's very mild, it might just be that it needs monitoring and nothing more. So there's a great big vast array. And so each case is kind of dealt with on a very individual basis in this scenario. So there isn't a one rule fits all for mitral dysplasia and tricuspid dysplasia. We know that some breeds are very predisposed to either mitral or tricuspid valve dysplasia. And the very common breed that we see with tricuspid dysplasia is the Labrador. So of all the breeds that we see, Labradors are prone to developing tricuspid dysplasia with an odds ratio of 11. So what this means is that they're 11 times more likely to develop this than another breed. And actually, when we think about the Labrador, they probably make up about 25% of all the cases of tricuspid valve dysplasia. Now, if these dogs have very severe disease, they might present to the clinic, or you might present them to your vet's clinic with a big swollen tummy full of fluid, or you might have felt that kind of very harsh murmur on their chest when you feel their chests as well. So again, for a little Labrador puppy, always encourage you to have a feel of their chests. Just put your hands on either side of their chest. It's not a typical place that we would listen with our stethoscope unless we have an index of suspicion. And so often these heart murmurs may go under the radar because of where we listen, because when we listen to heart murmurs, it's very, very much dependent on where we listen with our stethoscope. So if you do by chance feel that your dog has a bit of an unusual feeling on its chest, always mention that to your vet when they're doing their physical exam, because it may help them to detect and to find those heart murmurs and then evaluate them in more detail. So just to summarize then the treatment options, because we talked through a number of different conditions and different treatments. The first thing is that not every congenital heart condition means a poor prognosis. There are some that are curative, there are some that are very manageable, and the ones that we can manage may mean that we can get the dogs to a very ripe old age as well. So even if we can't cure it, we can get them to live a very happy, normal life. With mild congenital heart disease, we may never ever need to give any treatment. With moderate, perhaps we need to give treatment, maybe not now, but maybe in the future. And when it's severe heart disease, severe congenital heart disease, often there are things that we can do in that younger age that may help to prevent them from having trouble as they get older. Now, that treatment might be medical and it might be surgical. And in the rare cases of congenital heart disease, so the ones that we don't see very often, the once in a blue moon conditions, it might be that we have very limited treatment options. And sometimes for these very severe conditions, particularly when it's affecting the quality of life of the individual, we may have to counsel of whether it's the right thing to continue treatment in those patients, particularly if it's affecting, a puppy's day-to-day quality of life. When we think about puppies, a puppy is a puppy, and to try and tell a puppy not to run around and be a puppy is very difficult. And so there are times where we have to make those very difficult calls as well. But generally, there are many things that we can do for those very common conditions. So I'd like to share now with you a video of Teddy. And Teddy is an 8-week-old Staffordshire Bull Terrier that came to see us in our clinic. And this is the video showing you Teddy. Teddy has a patent ductus arteriosus, so he has a PDA. And actually, when Teddy presents to us at 8 weeks old, he's already in heart failure. So his heart is already failing him. And this is about 1.5 minutes, this video. And what you'll see during this video is firstly, Teddy when he presents, Teddy during his operation and what it looks like when a puppy has an operation, and then also how Teddy looks about 1 hour after he wakes up from his anaesthetic. So I'm just going to share this video with you just now. So this is little Teddy, and Teddy after his surgery. Now, you can see from the very beginning of this video that Teddy was really struggling with his heart condition at the beginning. And within an hour after surgery, he's now running around like a puppy should be running around. And just a really nice example of what we can achieve when we detect these heart murmurs early. Now with Teddy, he was 2.2 kilos. Now we get down to about 1 kilo. So we can operate on puppies as small as 1 kilogram with the minimally invasive keyhole surgeries. So I'd just like to spend a couple of moments talking about the innocent murmur. And this is something that I hear in consults sometimes for murmurs that were classified as an innocent or a flow murmur in a young animal that actually weren't. They were the wolf in sheep's clothing. And in this video, in this next couple of slides, we're just going to discuss, well, what does it mean to have an innocent heart murmur? And what is it that we're saying in this scenario? So an innocent heart murmur is a murmur where there is no underlying heart disease. So there is nothing causing the murmur in terms of structural heart disease. Now, it may occur in up to a quarter of puppies, but these puppies are young. They're under 4 months old. And the murmur tends to be in a very specific location, and it tends to be a low-grade murmur, so grade 2 or less. What's really important with this, though, is that I can't tell you, even after 20 years of experience, whether it's an innocent murmur or not, because mild congenital heart disease will sound exactly like an innocent murmur. So whilst we can say to you that it could be an innocent murmur, we absolutely cannot be certain on that. And so if the murmur persists, the recommendation is always to have that murmur assessed. And there are other reasons or other times where we may recommend assessment as well. So particularly if it's a breeding line. So if there is a murmur that develops in a breeding line, we'd always recommend that breeding line is assessed, because what might be a mild murmur in mum and dad may become a more severe type of the condition in the next generation. And a great example of this is a little corgi puppy that I saw. And she came in, she's called Apple, and Apple, the corgi, came in with the PDA. It turned out that there was another corgi in the litter that had a PDA as well. And when the breeder came in with the second puppy, she said, and I said, this is what the PDA feels like, having a feel of that chest and feeling the dog's chest. She said, oh, actually, the mum has that. She's had that all her life. And then we assessed mum the corgi, and mum the corgi had a PDA too. So there is a very strong genetic link in some of those breeds, and it can be passed from one generation to the next. So if we have congenital heart disease, whether it's mild or not, the recommendation is not to breed from those animals. Now, if the murmur is grade 3 or above, so if it's a moderately loud murmur or above, I'm always going to suggest that an assessment is made, so an ultrasound is done, or if there's family history, like I mentioned in the corgis, and if there is also symptoms, so if there are any clinical signs in the puppy, so it's lethargic, it's not gaining weight, it's got difficulty breathing, it can't exercise properly, or it's fainting, we're always going to recommend those aren't going to be innocent heart murmurs with those sorts of clinical signs. And finally, before we go to our Q&A session, I just wanted to make a little touch on projects that are currently being run and opportunities for future research. I think I probably have to give a kind of a trigger warning that we're going to be talking about fading puppy syndrome. And fading puppy syndrome is something that no breeder and nobody that raises a litter would ever want to see. But unfortunately, it does happen, and we do see fading puppy syndrome. So when we think about fading puppy syndrome, it's puppies that don't make it beyond the stage of weaning. And when we think about fading puppy syndrome, it's a form of neonatal death. And when we think about neonatal death, that is a dog that succumbs to its condition within the first 2 to 4 weeks of life. So these young puppies that don't really make it through the weaning process. Now, if we look at the studies that are out there, the studies would suggest of nearly 11,000 litters, that about 8% of all puppies will die before they make it to 8 days old. And of those puppies that die before a week of age, about half of those will die in utero. So they'll die before they're born, and they'll be stillborn puppies. And what we also know is if you pass a stillborn puppy, your risk of having another puppy that passes away in that litter doubles. So whatever's caused that puppy to not develop properly during development inside mum, it can be that whatever's caused that can have an impact on the puppies, or it might be whatever caused that might be present in one of the other puppies as well. But what we don't know in our puppies is why it happens. So why do puppies have fading puppy syndrome? And there are lots of things that are postulated of reasons why that might happen. But what we know is it's a combination of that the puppies stop feeding, and when they stop feeding, they become dehydrated. And when they become dehydrated and they're not feeding and they're not getting the warmth off mum and they're not getting nutrition in, they start to become cold. And when they're not feeding and they're becoming cold, their blood sugars are going to drop and they're going to develop a low blood sugar. Now, why does that happen? Well, sometimes we just don't know. We call it fading puppy syndrome without knowing. Sometimes we consider, and some of the thoughts are that some puppies might get pneumonia, but certainly a number of these puppies are likely to have underlying heart disease. And so what is currently going on in terms of research is a study called the CONNECT study. So CONNECT study is the prevalence of congenital heart disease in neonatal puppies experiencing a sudden death at home. And they're using very advanced methods of imaging to understand what's going on. And when we think about this, this is a really, really sad and difficult time for everybody when a puppy is lost. You know, a lot of love and care and support goes into raising a family of puppies, and so it's really important that we try to understand why this is happening. And there's a very, you know, when we look at this, there's a very strong link between early death and heart disease, and we just don't know what's going on in these young puppies. So if you do have a puppy that dies in those first 4 weeks of after birth, it would be really helpful if you are in a position, to look at this study, the CONNECT study, which you'll find information from on the website. So the CONNECT study. This is a study that's being funded by the Kennel Club and has a number of very good teams involved from the human hospitals, Great Ormond Street Hospital, and a number of vet practices as well, and cardiologists, really trying to understand what's causing it. And if we understand what causes fading puppy syndrome, we can be in a position perhaps where we can start to reduce those numbers of fading puppies as well. So we're just now reaching the end of my talk, and I'd like to just ask you to have a think about this last hour of discussion, and what is it that you've taken from this evening? So what are your key takeaways from this from our webinar that we've just had? Just to kind of get you to think about what is it that you would take away and share with a friend or a neighbour or a member of your family? And you can just kind of have a think about this, or certainly I'm happy for you to pop that in the question and answer session that's coming up in a second as well. But as I was writing the talk, I guess the things that I hoped that might come across is just how common congenital heart disease is. 1% of the whole canine population of puppies, which equates to about 10,000 puppies every year that develop some form of congenital heart disease. Remember, it can be mild. Remember that some dogs will have mild heart disease that never causes them a problem in their life and doesn't necessarily need treatment or surgery. But we're only going to know whether it's mild or moderate or severe by investigating it. But we do know that the louder the heart murmur, the more likely the disease is to be significant. So more likely that it's going to be something that's going to need some form of evaluation. Remembering that an innocent murmur or a flow murmur is a low-grade murmur, and it's gone by about 4 months old. So if that murmur is present at second vaccination, and certainly if it's a grade 3 murmur or more, it should certainly be looked at and investigated. Some murmurs will get worse over time, so your vets might detect a heart murmur when a puppy is young, and then when it's assessed several months later as it's grown, its murmur may have become louder because the heart doesn't grow or the disease doesn't allow the heart to grow properly. And so as the dog is growing, there's more demands put on the heart, and the heart murmurs may get worse as time goes by. Ultrasound is always going to be the best way to assess for congenital heart disease. As we said, in the right hands, it will diagnose over 95% of all congenital heart conditions. And to remember from that little video of Teddy that minimally invasive surgery exists, and it can give dogs a completely normal shot at life. So something to consider in a number of the congenital heart conditions that we evaluate for. So back to Bertie. You would have seen Bertie on the slide when we talked about the heart murmur and how to feel for a heart murmur at home. And Bertie came to see me about 8 years ago. And this is Bertie on his first day at my house with my little boy, and on his first day in the hospital meeting my Vizsla, Izzy, who you've seen in these slides as we've gone along as well. And they hit it off like a house on fire. Bertie had pulmonic stenosis. So Bertie, the videos of the pulmonic stenosis was Bertie. And Bertie had his surgery. Bertie here is waking up in the incubator to keep him warm on the left-hand side. Here he is in the middle, just waking up from his operation. He's a whippet. He loves soft, warm things, as you can see here, that lovely warm vet bed. But he came home with me about 12 hours after surgery. So he had a little stop in the hospital overnight just to make sure he was nice and comfortable. And then he came home with me. And now this is Bertie now. Bertie has a love for hats. He has a love for blankets. He has a love for the beach. And also for wearing a jacket as well, as all whippets do as well. So this is Bertie, and he just goes to show, as well as Teddy, that dogs can have a really good shot at life, even with congenital heart disease. And with that, I'd like to stop sharing my screen and answer and take any questions that you may have. And I'm very excited to hear how you found this talk and what questions you have for us as well. So I'm going to try to stop sharing my screen just now and come back online. Hannah, I might need a bit of help here.
No, I think you're all right. We can't see you at the moment, but you did freeze halfway through, so hopefully you'll come back. But there you are. We can see you again. Perfect. Thank you so much for that. I appreciate it. There's a lot of information to pack into an hour there. So thank you very much for giving us sort of such a clear overview of all of those.
You're welcome. You're welcome.
Perfect. Right. So let's move on to the questions. We have got quite a few pre-submitted ones, and we've also had a few in the Q&A as well. So I'll sort of flip between the two.
Sure.
So something that comes up quite often when we're thinking about dogs is diet. And one of the questions here is how diet can sort of impact a dog's outcome, and whether this is sort of similar to what we see in humans.
Yeah, a great question. So when we think about congenital heart disease, probably has less of an impact on congenital heart disease. These are hearts that are developing, they develop abnormally inside mum. So I think kind of when we think about those congenital heart cases, perhaps it has less of an impact on the progression of that heart condition. But if we think about heart disease in general, there are some heart diseases that can be linked to diet. So perhaps they have low levels of taurine in the food itself, or they have low levels of protein. It might be they also have high elements of grain in them as well. So grain and grain-free diets had a big moment a few years ago with a link to a type of heart condition called dilated cardiomyopathy. And if you go back to one of our old webinars that we've had with the Kennel Club, that's discussed in a bit more detail. But the grain-free diet was actually something that was noted in the USA. So all the studies on this came out from the US, and it was linked back to a few particular diets. And all of these diets had in terms of substitution for grain, had high levels of leguminous vegetables. So that's like your peas and your kind of your pea shoot type vegetables, soy, that type of thing as well. What we haven't seen in the UK is the same level of that disease here. So either it's because we're using different types of product, or it may have been specifically related to particular diets then as well. The other thing to mention is that is kind of diet and body size and body condition. So as a cardiologist, when someone asks me about diet, we'll always sort of want a dog to maintain body condition. We know that a skinny dog with heart disease is going to have a poorer outcome than a dog that maintains its body weight. And that's often because the more severe the heart disease, the more weight that they lose. So I would rather a dog is eating food well and reliably than to have them on a specific diet to manage them for heart disease. But there are diets available with low sodium in them, some sodium restriction. And a sodium restricted diet will mean that the dogs get less sodium, and having less salt in your diet does mean that you're going to retain less water. So there is value to be on a low sodium diet, but I guess the important thing is making sure that dogs continue to eat well. And when you have heart disease and you've been in heart failure, the dogs do feel a bit ropey and a bit rubbish whilst they're recovering from it. So my kind of major advice is to make sure the dogs are enjoying what they're doing, so enjoying their food. And if you have a dog that's a gannet, so I'm particularly thinking about those Labradors out there, and they're going to eat any type of food that you give them, then I think it's worth trying those dogs with congestive heart failure on a low sodium diet, so a salt restricted diet. But otherwise, all we tend to say is really restrict the very salty treats, but just give them the diet that they're used to, that they're going to eat well. But when dogs have heart disease, we do see their appetites wax and wane. So some days they'll eat really well, other days they won't eat so well. And often then what you end up doing is sort of changing the diet every day, and the dogs start to kind of get this very picky appetite. So kind of as long as they are getting nutrition in and not losing weight, that's key. So rather than keep an eye on how much they're eating, are they maintaining their weight? That's kind of more important to me than whether they kind of reduce their appetite a bit, because they will inevitably eat a little bit less or eat more inconsistently, but overall will still kind of get the nutrition that they need.
Great, thank you for that. So the next one we had was looking, it's quite a similar sort of topic, is looking at general healthy lifestyle before breeding a litter, and whether this has any sort of relevance in terms of passing on heart issues. So if a dog is a sort of poorer lifestyle, is it more likely to possibly pass on or cause congenital heart disease in its litter?
Yeah. Okay. So, is there other things that you could do for a dog's lifestyle before they're used for breeding? I think probably the most important thing is probably like the preventative healthcare that we recommend, which is vaccination, and trying to reduce some of those diseases that if they pass to the puppies, or if mum contracts an illness of the things that we can vaccinate against, can cause abortion and can cause stillbirth, and then can also cause neonatal death as well. So be thinking actually it would be important to make sure that firstly that they're on a good quality diet that's got a good level of protein. In terms of for dad, again, for dad, less of an issue, because in terms of how sperm is produced, the quality of sperm doesn't change dramatically with lifestyle for the dogs, but for the female dogs, it has more of an important part to play to make sure preventative healthcare is good, worming history is good, so that the puppies don't end up with a high worm burden, because that can also impact the litter as well. And once the litter is born, that we're worming that litter appropriately, or at least monitoring for worms if we're not worming them. Some people advocate for kind of just natural worming and just worming as and when worms occur, but it's really important that you are keeping an eye on worm counts and worm burdens in that scenario. And often for most breeders, we are kind of looking at kind of more of a worming protocol as opposed to just monitoring for worms.
Great, thank you. So the next one that I had was moving more into the sort of inheritance side of things, particularly with PDA. So we've had a breeder here who unfortunately had a puppy bred that was affected with PDA. And in their instance, they've used the same stud on their previous litter, which resulted in no affected puppies. So they were sort of asking whether this could have come from mum or dad, or if we're sort of not too sure at the moment in terms of inheritance of this.
Yeah, good question. So does it come from mum or does it come from dad? I don't think we have that data very, very easy to kind of pull out. But often what the Kennel Club can do, because we have these pedigrees, is when we identify heart disease, we can look back at lines. I mean, obviously this is confidential, but we could look back at lines to see if there were particular individuals, which might give us some information whether it's more likely from mum or from dad. But obviously it's confidential that we can't share beyond that. But when we think about some of these PDA breeds like the German Shepherd and the Newfoundland, they are breeds that are 4 or 5 times more likely to develop a PDA than any other breed. So that goes to say that there is certainly genetic involvement. It's hereditary in some of these breeds. The other thing to note is that mum and dad can be completely unaffected. They don't have to have a PDA to pass it on. They just have to have the genes that can pass it on. So it's not uncommon that you may have 1 or 2 litters where there aren't any PDAs, and then suddenly you get a PDA that's thrown up. And so sometimes it might just be a wild card, a wild freak mutation of your genetics that means that you end up with a PDA. But because we know that there are a number of breeds that have an increased risk of a PDA, we also know that there's a lot of times where it's not just a freak of nature or a freak of an accident of nature in terms of genetics, and that these are probably hereditary in origin. But whether it's mum or dad is very difficult to say. I guess the good news about PDA is it's one of those things that's fixable. But once we diagnose the PDA, we then have to be very vigilant in the breeding and identifying if you're getting more. So generally, we might sort of say perhaps mating mum and dad together again might not be the best idea, and trying to widen the genetic pool on the next occasion.
Thank you. So moving on over to aortic stenosis, we've got a question here from someone who's got a dog affected, and asking how they sort of manage and exercise a dog that's affected with the condition.
I'd love to know. So I'd love to know the breed, because sometimes it's really, as sitting here as a cardiologist, I could tell you what I'd like you to do with your dog. But I think what's really important is actually thinking about the dog themselves. So Bertie, my whippet, for example, has pulmonic stenosis. He is a whippet. To try and stop a whippet running after a squirrel, unless they're going to keep him on his lead his whole life, he's going to chase a squirrel. And before he had his surgery, he would run and he would faint, and then he'd wake up very quickly, a bit like Ginger in the video earlier on. And I think you have two camps that think about this, and I think there's two really important ways to look at it. So one is focused on trying to reduce the risk of the dog having an adverse event, so trying to reduce the risk of a collapse, trying to reduce the risk of a sudden death. The other school of thought is saying, well, this is a puppy or this is a dog or a breed that needs to be exercising, and then going down that route. So I think you've got the opportunity to say, well, let's try and prevent things as much as we can, or let's let the dogs live a dog's life. And I think that's probably what it comes down to for me. And obviously, when I talk about Bertie as a personal preference, I let Bertie be a dog, and we didn't restrict what he was doing as he was growing up. But what we do know is that if you put more strain on the heart with aortic stenosis, you do increase that risk of sudden death. And so if this was a dog that had severe aortic stenosis, we might want to try and limit severe exercise to reduce that risk of sudden death. But sudden death can happen both at rest and in exercise. So this is partly why when we're talking about it, we would counsel an owner of a puppy with aortic stenosis to say, what is it that you want for your puppy, so that we make sure that we tailor our advice to the situation, because what would be relevant for one puppy might be very different for another. But if I was thinking about it overall, exercise restriction, taking strain off the heart would be your best way to kind of wrap the heart in cotton wool. But even when we do that, we still see dogs that succumb to their disease. So then when you look back in retrospect, you might think, maybe we should have let that dog do a little bit more exercise. And I guess as a personal preference, this is what I would do with my dog, and I would let the dog be a dog. But I completely appreciate that that's not what everybody would do. And if you ask 10 cardiologists in a room, they would have the answer that is, the answer that means that you are giving the kind of the most kind of defensive way of looking after a dog, so kind of the way that you can be kind of avoid any complications, versus the ones that might own a dog that has a heart problem that might do it differently. And so I think it's very personal, but I think all options are valid and all options are on the table in terms of how to exercise that dog. The only thing I would avoid is anything really strenuous, so like ball throwing, of high intensity agility. But if the dogs are able to kind of warm up and like run and kind of increase their exercise and then slow themselves down, so it's not kind of that sudden sprinting type exercise, that generally is kind of that more kind of aerobic type exercise probably is better than intense sprinting.
That's great, thank you. Yeah, I like that, letting a dog be a dog and being, aware of it, whilst also sort of balancing up what their personalities and are like as well. So then one of the last ones we had for the pre-submitted was looking at bigger litters and whether you think this is congenital heart disease is more likely to be seen in a bigger litter.
I think by nature of the percentages, so if we think about the number of dogs that have it, so 1% of the population, or was 2.5% of pedigree dogs might have congenital heart disease, you can kind of imagine the bigger the litter, the likelihood or the kind of the chances of you having more puppies with the condition increases as well. And I remember I said that litter of corgis, so 2 corgis in a litter, and mum also then subsequently was diagnosed with a PDA as well. So perhaps more so because of more so to do with just the likelihood because of numbers, rather than because the litter is big and that means that there's an increased risk of congenital heart disease. So we don't see it more because it's a big litter. In that litter of corgis, it was 3 puppies, 2 of which had a PDA. So it doesn't have to be a big litter to see congenital heart disease, and I don't think there's a link between bigger litters and congenital heart disease that I'm aware of.
Okay, thank you. So just moving over to the Q&A, we've had a couple of queries from Newfoundland people, and I appreciate, I don't think they came up in your presentation, but we do know that we have a concern with subaortic stenosis in the breed. Right. So we've had a query here with from an owner who had a dog diagnosed with SAS as a puppy, and they're asking how much worse is it likely to become, and is there an age where it doesn't get any sort of worse, and does it sort of depend on the degree of stenosis from birth?
That's a great question. So love a Newfie, and the Newfies didn't feature in my slide, but we do see aortic stenosis in the Newfies. So there's so many breeds to try and include on those slides, and if I put every single breed on, there'd be you wouldn't be able to see the words, because congenital heart disease does occur, although it's more common in some breeds than others, it can occur in any dog. So don't, when we kind of, as a take home, it can occur in any dog, but there are some breeds that are more featured than others. But Newfies are one of the breeds that we see with subaortic stenosis, and Generally, what we think about when we think of some of the other breeds is when they're fully grown, when they get to full maturity, which for a Newfie is a little bit older than, for example, a boxer. We know, like in the boxer, though, that once they reach full growth at about 12 months old, their murmurs are unlikely to worsen, or their stenosis is unlikely to worsen beyond that point. So what they have at about 12 to 18 months old, thinking about a Newfie, and when a Newfie is fully grown, that's what they're going to have to contend with for the rest of their life. So that's when we know how bad the disease is going to be, is when they're fully grown. But when we think about stenosis, it's that narrowing at that age. But then in terms of what happens to the heart, it's then over time, the heart's put under a level of strain and stress. So what they have at a year or a year and a half old is what they'd have to contend with for their lives. So if it's severe at a year old or a year and a half old, they then sort of have those risk factors that we talked about in terms of clinical signs, potential for wobbliness and wobbly episodes. But some dogs still manage very well. So some dogs will still have, if 20% might have a sudden event and a third of them might have clinical signs, we're actually saying that the majority of them actually are quite happily living with that condition. I appreciate as well, I was just going to say, Hannah, I know that we are running on in time, but I'm very happy to answer some more questions. I don't know if you're having to look at the clock, but I am happy to stay for more questions as well.
All right, that's amazing. Thank you, because we do have a few more in here. So I was trying to pick, but they're all very good. So when this is from another Newfoundland person, but it does apply to other breeds as well, looking at puppy cardiac screening. So this is something that in Europe, this breed is reported has been done quite routinely of screening litters before they go to their new homes. Is this something that you see much value in, or is something that the breed should be sort of encouraging at that kind of age? And they're just sort of interested to get your thoughts on that.
Yeah, it's a great question. So we, the Kennel Club and the Veterinary Cardiovascular Society do screening days for Newfoundlands to look for subaortic stenosis and to assess dogs for subaortic stenosis. And we know it's a hereditary condition. So we're starting with the sire and the dam, and looking at kind of the breeding stock. But we don't routinely see whole litters of puppies for assessment and evaluation. As much as I'd love to see a big basket full of Newfoundland puppies, it doesn't happen very often that they come to see me as a cardiologist, but they probably will go to have their first assessment with their own GP vet, and potentially their first vaccination and second vaccination. And if a murmur is detected in a Newfie, particularly because we know about subaortic stenosis, we'd be recommending that they have an ultrasound scan. But as a rule, screening the whole litter, we don't tend to screen those. We're really sort of trying to reduce the incidence of the disease by looking at the breeding pairs as opposed to the offspring, but we'll assess the offspring if they do have any clinical signs of disease.
Okay, thank you. We've got a question here about surgery and the associated costs with this. So Del here has said, whilst I'm in awe of modern surgical treatment, unfortunately it is quite cost prohibitive, and because it's congenital, quite often insurance cover is not always possible. But in your experience, are there any degrees of congenital heart disease that would make it possible for insurance cover from your sort of view as a veterinary cardiologist?
So I'm going to maybe break that into two. So perhaps like dogs that have congenital heart disease when you're trying to then get insurance, and then dogs that have congenital heart disease with insurance. So occasionally, and it's not uncommon that murmurs aren't detected. So if I think about a puppy that has a PDA, about half of the puppies that I see haven't had the murmur detected before they have their insurance taken out. So the vets have done their assessment and the murmur has gone undetected. And there's many reasons why that might happen. But then as long as that murmur is not detected in what we call the cooling off period, many insurance companies will take liability for the claim. Some insurance companies will manage that differently, and they'll say if it's something the puppy could be born with, then we won't include it. Whereas other insurers will say if it's not been noted by the vet within the first 2 weeks of taking the policy out, then we will cover for whatever is diagnosed after that subsequently. So there is a bit of difference. And again, obviously, depending on when you're listening to this webinar, it might be that insurers have changed the way that they approach insurance. But then if we think about the puppy who then has a congenital heart condition that then you're looking for insurance, generally, I guess most insurers are then going to exclude any congenital heart condition, but they'll still allow you to take an insurance policy out for everything else that you could insure a puppy for. And if it's something like a PDA that can be cured, if we then write a letter as a veterinary specialist to say, actually, this condition has been cured, we're signing the puppy off, then actually after a year of not having any problems, sometimes the insurance companies will review what's been excluded and maybe lift those exclusions as well. So it's really a question for each individual insurance company because they all do it slightly differently. But I do appreciate that that when you have a patient with congenital heart disease and you have a puppy at home with it, it can then be difficult to get kind of comprehensive insurance that covers everything. Particularly if they already have a congenital heart condition that then gets worse over time, it's unlikely that the insurance company will cover that because they might consider that to be a pre-existing condition.
Thank you. Yeah, I guess it really hits home that you need to try and get into all those T's and C's when you're looking at getting insurance policy out, because they will unfortunately catch you out sometimes. So I'll leave it with this is our last question, I think, that we've got for tonight. But it's from Bill, who says, thank you very much for an informative and interesting presentation. Just a comment that we didn't really speak too much about the heritability of these conditions, and I do appreciate you're not a geneticist, so this is not so much your sort of your area. But from a breeding perspective, a primary concern is to produce healthy puppies. And your advice has been to sort of not to breed from an animal that is affected from any heart disease. So is it possible to provide some further comment on this, bearing in mind that we've got some of the audience that are breeding from numerically small breeds and facing challenges with their genetic diversity?
Yeah, that is a great question. And I wish we had a geneticist on the line as well, because that would be really helpful. But I think I can only really think of it as a veterinary surgeon as opposed to kind of a geneticist. And I think, when you have those very small lines, you have to just choose the best breeding stock. But if you only choose the best of the breeding stock, you lose your diversity. So, there will be times where we will see diseases, not necessarily congenital heart disease, but, other diseases that might creep in as well. And I think it's really about then, if you do diagnose those, if they do get seen, is then just making sure that you've got the vigilance to monitor the outcome of any subsequent litters. If it becomes a very frequent issue, then absolutely we've got to start looking at where did it start to come in, and then look at what level that was, and then sort of backtrack through the pedigrees to look and see is there a common offender, and we see this. So we see this in a number of the diseases. If we look through pedigrees, and we have a breeder who starts to have problems with litters, and we look through the pedigrees, sometimes we can trace it back to a potential mating that may have been the cause. So I think it's just really important to stay vigilant, to look back and really look at those pedigrees over time. And I do understand that when you've got those very small breeder pools of genes, that sometimes you have to kind of factor in. And obviously we're talking about congenital heart disease here, but there are all the other types of diseases that we need to factor in too. So to breed a dog that has no health problems is obviously always going to be our goal, but just one of those things that we're never going to completely achieve. But trying to get rid of those really horrible conditions that can be life limiting is important. So it sort of just depend on the condition, and depends a little bit on what's more common in that breed. But for example, if it were I'm just going to look at one of my lists that I kind of wrote a little bit earlier. But if we look at the if we look at the French Bulldog, where they're 19 times more likely to get pulmonic stenosis, we really want to make sure that we're not breeding from those dogs that are throwing up little puppies that develop the condition, because that's that is a really high odds ratio to be 20 times more likely to get the condition. We really need to make sure that we're being vigilant in some of our breeds, and that's just taking the French Bulldog, for example, but there are many other breeds that we need to be aware of as well.
Brilliant. Thank you very much for that. Okay, so I think we'll close it there with the questions, but thank you to everyone who's joined tonight, and thank you, Chris, for that fantastic talk, and also for staying with us for a little bit over time as well. It's really appreciated. So just to wrap up, we have recorded today's session, and it will be available on our Kennel Club YouTube channel shortly, and we'll also send a link to everybody who's joined tonight with a short feedback survey just to get your thoughts. You can also access all of our other health webinars on our YouTube channel, channel, and these span a huge array of topics, including common cancers, breathing issues, back disease, epilepsy, and health testing. And you can also watch back those heart webinar series we were talking about earlier. If you have any other questions, comments, or feedback, please do get in touch with us. Our email is health@thekennelclub.org.uk. So thank you very much. Thank you, Chris, and have a fantastic rest of your evening.
Thank you. Thank you to everyone at the Kennel Club, and thank you everyone for attending as well.
Cheers.